Hello everyone, welcome back to Sowkya Vision. Today we are going to discuss the nerves, the major nerves of brachial plexus that are going to supply the total upper limb. Yes, today we are going to start with median nerve. Yes, it is a major nerve. It is a major branch of brachial plexus. What are the main nerves that are mean spinal nerves that are involved in the formation of brachial plexus? They are C5 to T1. C5, C6, C7, C8 and T1. These are the nerves that are going to form. These are the spinal nerves that are going to form brachial plexus, right? The major branches of brachial plexus are axillary nerve, musculocutaneous nerve, median nerve, radial nerve and the ulnar nerve, of which median nerve, radial nerve, ulnar nerve are the majorly important. Today we are going to start with the median nerve. So the root value you are going to, when you are going to write the any nerve, any major nerve, start writing with root value. Yes, the root value of the median nerve is what? It is the nerve that is having all five roots. Is what are the five major roots? C5, C6, C7, C8 and T1. Yes, these are the roots that are going to form brachial plexus, right? So these are the five roots that are also going to involved in the formation of median nerve. So what are the roots? C5, C6, C7, C8 and T1. The root value is C5 to T1. Yes. How it is formed in the axilla? We are going to discuss each nerve as under axilla, arm, forearm and the hand region. How it is divided and contributed and distributed in different area and different muscles. Yes, in the axilla, these five roots, the C5, C6, C7 and C8 and T1 are going to form median nerve. Yes, when it is passing to the from axilla to the arm region, it is related to brachial artery. Is brachial artery is what? It is a continuation of axillary artery. So here it is axillary artery. It is continued as brachial artery, right? So now our median nerve is in the proximal region. That is in the that is closer to the axilla. In the proximal region, upper part, when it is divided into three parts, the upper part, in the upper part, the median nerve is laid lateral to the brachial artery. See, this is the brachial artery. The median nerve is lying lateral. The median nerve, yellow one is the nerve, is lying lateral to the brachial artery. Yes, it is going to cross brachial artery anteriorly. It is going to cross brachial artery, that to anteriorly. See, if it is a brachial artery, the median nerve is going to cross like this from above the brachial artery. So median nerve in the upper part lying lateral to the brachial artery. In the middle part, it is going to cross from lateral to median. Yes, it is going to cross lateral to medial anteriorly. So in the middle part, it is presented anterior to the brachial artery. So in the lower part, it is present medial to the brachial artery. In the lower part, it is going to it is presented medially to the median nerve. Yes, it is presented medially to the brachial artery. So in the upper part, it is presented laterally. In the middle part, it is presented anteriorly. In the lower part, it is presented medially. Yes, from lateral to medial, it is crossed along the brachial artery, that to anteriorly. Yes, it is the course of median nerve in the axilla and the arm region. When it is coming into the forearm region, the nerve is crossing bicipital aponeurosis. As we know, the biceps brachii is inserted as two forms. One is tendon form, another is the aponeurotic form. So here our median nerve is going to cross bicipital aponeurosis. In the arm region, it is going to cross, it is going to enter into forearm region. Yes, our biceps brachii tendon is also inserted as aponeurosis, bicipital aponeurosis. So our median nerve is going to cross bicipital aponeurosis and enter into forearm region. In the forearm region, the course is when it is entering into the forearm, it enters through two heads. The pronator teres is containing two heads. Yes, it is crossing between two heads of the pronator teres and giving nerve supply to them. Yes, it is going to cross between two heads of pronator teres and it is entered through flexor superficialis muscle, to which it is going to supply. Before entering into flexor superficialis muscle, it is going to give a branch, anterior interosseous nerve. Yes, anterior interosseous nerve before entering into the tendinous arch of flexor superficialis muscle. Yes, before entering it is giving two branches to the muscles, flexor carpi ulnaris and palmaris longus. These are the two muscles it is going to supply before entering into the tendinous arch of flexor superficialis muscle. And it is also giving a branch, anterior interosseous nerve. Yes, that anterior interosseous nerve is passing between flexor pollicis longus and flexor digitorum profundus. Yes, that anterior interosseous nerve is going to pass in between flexor pollicis longus and flexor digitorum profundus and giving nerve supply to the pronator quadratus. Pronator quadratus. It is going to supply pronator quadratus. Now the main branch is continued, supplied to the flexor superficialis and continued through flexor digitorum profundus. It is continued through flexor digitorum profundus and entering at the flexor retinaculum, crossing flexor retinaculum. Before crossing flexor retinaculum, it is going to supply flexor digitorum superficialis and flexor carpi radialis tendons. Yes, the tendons of it is going to supply the tendons of flexor digitorum superficialis and the tendon of flexor carpi radialis. Now, after crossing flexor retinaculum, it is entering into the hand region. Yes, it is entering into the hand region. Here it is going to give a palmar branch. It is the palmar branch, right? This palmar branch is going to supply here to the retinaculum. Now, it is crossing retinaculum. Immediately after crossing, it gives the recurrent branch. It gives the recurrent branch. And it gives three common digital palmar nerves. It's going to give three common digital nerves and proper palmar digital nerves. Yes. Now, what are these common digital palmar nerves? These are going to divide into two branches, supplying lateral and medial aspects of thumb and the lateral three fingers. Yes, index finger completely, middle finger completely, and half of the lateral ring finger. Yes, half of the ring finger it is going to supply. Once again, in the axilla it is going to form by the root C5, C6, C7, C8 and T1, and it is going to cross brachial artery from lateral to medial. In the upper part it is presented lateral to the brachial artery. In the middle part it is presented anteriorly. Why? It is crossing lateral to the medial. So it is presented anteriorly, and in the lower part, the lower part of the brachial artery, it is going to present medial to the brachial artery. Yes, it is crossing from lateral to medial, that to anteriorly. Yes. And when it is entering into the arm region, it crosses bicipital aponeurosis, entered between two heads of the pronator teres, supplying flexor superficialis muscle and giving, before supplying to this muscle, it is going to give anterior interosseous nerve, which is going to supply the pronator quadratus, and the main branch, it is going to gives nerve supply to the flexor carpi ulnaris and palmaris longus and supplying tendinous arch of flexor superficialis, entering into the flexor digitorum profundus, and it continued and giving nerve supply to the tendon of flexor digitorum superficialis and tendon of flexor carpi radialis. It crosses retinaculum. When it is crossing retinaculum, before entering the retinaculum, it gives palmar branch, which it supply to the retinaculum. Yes, and it is going to give three common digital palmar nerves, and it is also supplying to the lumbrical 1 and lumbrical 2. There are four lumbricals, right? So here it is going to give nerve supply to the lumbrical 1 and lumbrical 2. Yes, these common digital palmar nerves are going to divide into proper digital palmar nerves. Yes, each digital palmar nerve is going to common digital palmar nerve is going to divide into proper digital palmar nerves, which supply the lateral and medial aspect of index and the middle finger, and lateral aspect of, that is, half of the ring finger. The rest is supplied by ulnar nerve. Yes, anteriorly ulnar nerve. Yes, this is a complete discussion of median nerve. If you have any doubt, please comment in the comment section, like the video, share the video with your friends, subscribe to the channel. Namaste.